This meeting is being recorded by the Valley Steering Committee. If any other persons present are doing the same, you must notify the chairperson at this time. Call to order. The meeting will start at 8:31. Could we do a roll call of members? Bruce Bennett? Bruce, I think you're on mute.
Here.
Noreen?
Yes.
John Hillman?
Yes, I'm here.
Tim Hilchey?
He's on mute.
I think he's Tim, can you just say present?
Present.
Thank you. Public comment, no discussions or comments will be entertained unless.
Megan, there's one other person.
Oh, is there? It's not on
It
my.
says Mayor Greenfield.
Oh, that's he's not really here. That's Matt. He just he has to be our host.
Okay.
Yeah. He's just starting the meeting. He's probably just doing his other work in the background.
And is Mary not around?
Mary is in Florida this week.
Okay.
So I will take the minutes too. Or actually she'll probably watch the video recording and do it, but I can also do. Public comment, no discussion or comments will be entertained unless requested upon the chairperson of the board or the committee. I don't have any old business. Does anyone else have any old business?
This might be for old business, Megan. Our inspector is going to be away for 2 or 3 months. So you guys will be able to cover, the collaborative will be able to cover for both the septic systems, perk tests, and the food inspections.
Yes. Yep. Whatever
Okay.
you need, just let us know.
Okay, I just want to get it squared away so we know that for sure.
Yeah. Between Mike, myself, and Ryan, we said that we would do it.
Okay, thank you.
And just so you know, we have the same health inspector.
Oh,
Right.
perfect. Yeah. I do have a surgery that'll keep me out for about a week, April 16th or so. I can still do everything online. I can still review septic plans and things like that. I wouldn't be able to leave the house for a week or so, but Mike can cover for me and Ryan as well.
I think things can wait for a week then.
Okay. Did everyone get a chance to look at the minutes?
Yes.
Yes.
I just sent revised minutes with some suggested changes
Okay.
through email.
Yeah, and I actually had sent Mary a bunch of revisions.
You did. Okay. Let's table that then and we'll ask Mary to change them.
Okay.
Ask Mary to change. Okay. So, new business, Foundations of Public Health Survey. I'm going to share my screen.
Noreen, is your cereal good?
It is. It's oatmeal. Thank you, Tim.
Are you guys able to see this?
Yep.
Okay. So the state has told us that we need to do this Foundational Public Health Services survey. We had to take a class to learn how to take the survey, another class to figure out how to do the cost survey. All of these results are supposed to be gathered by some outside agency and sent to the Department of Public Health and the governor for review to see how much funding we're going to need through the SAFE 2.0 Act in upcoming fiscal years, because eventually the PHE grant will go away, and now SAFE 2.0, since that passed, the governor is going to be responsible for putting public health into her yearly budget. So we're not sure. So we think they haven't given us a lot of answers, but we think what's going to happen is towns that don't have a lot of services are going to get more money sent from the governor to their towns to supplement public health. Because towns like Leverett and Shutesbury, I'm assuming you can't afford to hire a full-time inspector and a full-time nurse and things like that, because you just don't have as many houses as some of the other towns. So we're thinking that the governor is going to send more funds to the towns that have, 25% answers instead of 100% answers. So this is
So can I ask a question?
oh, absolutely.
So does this mean the shared, how does this affect the shared services? I mean, what we
Right.
do right now is everything goes through Greenfield. You're paying, and all the funds, the Valley Health, Regional Collaborative is getting those monies. That's going to be changing is what you're,
Eventually, the grant runs out in fiscal year 27. So everything's going to stay the same as far as we know through fiscal year 27. But after that, they're going to have to figure it out in their budget.
so that 10-year thing that they talked about is just, they're just going to change the way they're going to do things. Is that?
I think so. But I think that if the governor sees that the collaborations are working in places, she may just say, okay, we'll just continue to fund the collaboration and let it go that way. I just know that the funding part is now going to be mandated by the state. So they are going to have to give us money for these type of services. So whether it'll come into a collaborative or go directly to the towns, we're not quite sure yet.
Okay, thank you.
No problem. So like Greenfields, you can see where it says, first we had to write here, does your local public health department do it? So in Greenfield, we do have a plan to address gaps and barriers, and ensure access to clinical care. Does our SSA do it? Yes. Do other organizations do it? Yes. So the community has, so I had to write in for every town, I had to write what you guys have for services. So in Greenfield, we have the community health center, ServiceNet, legislators, the mayor's community development department. How much does our local public health department do it? I said 25%. We have limited capacity because it's only me, and limited expertise because I am just not an expert on those type of things. But in Greenfield, 75% of the time, I think we have this covered. Some of the things, I'll click on Shutesbury. So Shutesbury looks a lot different than Greenfield because you don't have a lot of these outside services. Sunderland, I had yeses to a lot because somebody could take a bus to Franklin Medical Center, but in Shutesbury and Leverett, people just don't have those services. So for example, let's see. Well, we could just do the same one. Or develop and maintain public communications infrastructure. Yes, you do it, but it's minimal. We have local newspapers, social media, news channels, radio, limited, and I felt like it probably covered 50% of the time. Let's see. Develop and maintain trusted relationships with communities. Yes, you don't have anybody else, I don't think. Minimal, and I think it's rare because you don't have all of the people that we have. Like you don't have ServiceNet and ServiceNet and like the Beacon House and Wildflower Group and all of those other things. So I felt like these answers are pretty much the same for Leverett and Shutesbury. Here's Leverett's. And same thing like with communicable diseases. I put 0 for capacity because you don't have your own public health nurse, but yes, the shared service agreement will cover it. And actually I think is it this one? Conduct disease. So yes, here you have 0 involvement, absent, but you are covered completely 100% of the time because you have the PHE grant. So that kind of shows in this line that you couldn't do it on your own, but with these other programs, then you're able to do it. Does this make sense to you guys? I know it's really confusing. It's
Do you want us to review this?
Absolutely. I was talking, I went to a Board of Health meeting in Shutesbury the other day, and we said that we would go over it with them. I was thinking everybody could come to the office, but now that I figured out how to share my screens, we could do a Zoom call and I could share my screen and you guys could go over it. It's not a survey. I can't send this to you. It's not a survey that I can like email, but we could definitely set up a Zoom time and I could just share this whole screen and go over it with you.
What is SSA?
Shared service agreement. So
It
that
is,
is the Valley
that's
Health
what I was gonna
Regional.
guess. Yeah, yeah, okay.
So the next is inspector update. It's not going well. We've had,
So, excuse me
Oh, yeah.
one second. Can I ask a question? Do you have
Uh,
a preference if we do a Zoom meeting with you, or a couple of us come down and meet with you in the office?
no, whatever's easier.
Okay, thank you.
And who would you want to, you want, I mean, I don't think we would do this during a Board of Health meeting. How many participants are you looking for, and are you
It's-
looking for primarily just Board of Health members to do this, or?
Oh, yeah, yeah. And John, I think it's even okay if it's just you.
Okay, that's fine.
It's whatever, if everybody else is really interested in seeing it, that's totally fine. They are going to give us a summary at the end that we can share, but if you want to just go over it with me, that's absolutely fine
Okay.
too, because I think you know all the answers. I'm sure you know all the answers to these
No,
things.
I mean, quite frankly, I don't share a lot with our board. We just don't, it's, doesn't happen.
Kinds of handoff, yeah.
Megan, what's the time frame that this has to be completed by?
I have until March 1st to do this part of it.
Okay, okay.
And I have all of this part of it is all complete for all of the towns. So anytime you're ready, I can do this with you guys. So I'm clicking on Sunderland right now.
And thank you for doing all this.
Yeah, no problem.
Well, given that, Megan, I do have one other question that came up with our board is, if we didn't have you, obviously many of us wouldn't have had the capability to do this. No one on our board wants to go and take training and learn how to fill this out and learn how to use the software. So is there a way that we can try and make that known again to the people in Boston?
Oh,
I know
absolutely.
it's probably not on the form, but do you have a plan for
Yes. So there's no place to write it on this one, but there's a cost survey that's the one that I'm working on now. And there's a place for me to write notes, and I'm absolutely writing those type of things down there. Just that, we are a volunteer board of health and nobody has time to do this.
right?
It's not reasonable to have people think that, like, to have somebody go to a class and do this 8-hour survey voluntarily. It's just not.
Okay,
Not
thank
reasonable.
you. I
I
just
am
want to make sure that they're
Yeah.
continuing to be reminded that we're volunteer boards, and yes, exactly.
Yeah, and we've
It's just-
all been telling the state too and complaining on these meetings every couple weeks. We have to meet with we meet with Ileana and another group who's specifically for the FPHS, and we complain often.
Okay, yet they keep doing it.
Yeah.
Yeah.
Okay, thank you. I'll stop.
No problem. Tim, did you have a question?
Yeah, a couple of quick things. Have you managed to connect with Ned? I mean, and he's gone through this already?
He has not gone through this. I sent him an email asking for the cost survey. I think it was Monday, but I haven't heard back I haven't gotten the information back.
Okay,
He
so
said he
I'll
would-
prod him. And thank you again. I want to just reiterate that we all thank you.
No problem.
And I'm happy if Ned is the person that you work with for Deerfield.
Yeah.
And is it correct that at the end of this, we will not be able to get a physical copy of this form?
That's correct. You'll just get the summary part from the state.
Okay, thank you.
No problem. Anything else on this topic? Okay. So the inspector, we've had at least 4 to 5 interviews. Nobody has piqued our interest, I would say. Nobody really even has any of the basic qualifications. So we had one person that had a serve safe, and that was it. And that person I don't know, the personality wise, I don't think it's going to work out. Ryan's been sitting in on all of the interviews with us. Um, it's just not looking good. We've had so many people that we've had interviews set up and they just don't show up to the interview.
You're kidding.
Yeah, we have it posted everywhere. We put it at the UMass Public Health Department. It's on MAHB, MHOA. We have it on our city website. We are trying our hardest. We've asked, our friends at the FERCog to reach out to people. There is one candidate that looks really great, but that person's not going to be back in Massachusetts until April. So if we don't find somebody by April, maybe we could reach out. But it's just not looking good.
Is this position it's full-time
Full time.
and they basically have to be around all the time? It's most of the time. Yeah, because I know someone would be really good, but he moved further east. So
Can we
Yeah,
stop screen share?
oh, yes, sorry. Stop share. All right.
Megan,
Um,
are there any community colleges that have a program for training inspectors or anything?
Great question. No, but very soon to be yes. So Greenfield Community College is starting a program now. They're just in the beginning phases. So next year they should have the program up and running. It's just that it's not here yet.
Because it seems there's a big demand for
Oh,
this type
definitely.
of employment and stuff.
Yeah. Yeah. And really the hard part is that within 6 years, somebody is going to have their RS. So they really need to have a college degree or be willing to go take 30 science credits. So that's kind of where, it's hard to get somebody into this type of position that has a college degree.
Yeah, and also if it's not a regional position, it's difficult for little towns to actually hire somebody and pay them a salary that would make them willing to come to work. And even at 62,000, I think you're going to have trouble finding somebody. So I sympathize.
Yeah. And I think we do have some room in our budget to increase that, but it wouldn't be comparable with every other place. Like even Ryan was saying, that's a really high paying job for a beginner inspector. He was trying to get some of his friends to come down from like Ludlow area and things like that.
Mhm.
But he said that he just can't convince people to move because they're comfortable there, but he said that the pay
Yeah.
is
We
higher.
have you
We do live
reached
in a-
out to, I'm sorry.
We do live in a high cost area for housing, and that I think is very, people don't want to move here because of high cost of living.
Yep. Yep.
Have you reached out to Gina again? I don't know exactly why it didn't work out with her.
I can reach out to her again. She told us she had medical issues and that she couldn't do the time, but I can absolutely try again.
Gina still works for us part-time as our housing inspector.
Mm-hmm.
And I believe she just wants to keep it at a minimum type of work.
Yeah.
And there are times when she is unavailable for her personal issues. So
Yeah. I know she was wonderful. I absolutely loved her. I wish she would I wish
she
she would
does
be our inspector.
she does a great job for us.
Yeah, absolutely. Yeah. So I think just keep spreading the word, try to find anybody with at least an associate's degree would be great. Because we could help get more science classes, but
But
there's so much.
apparently, the RS is a very challenging exam, is what I've heard.
It is. I took
Even
it
from
in
people
June.
that are who have quite a bit of education and are pretty sharp.
Yeah, I feel like for me, it's really easy to take tests. I've never had a problem with it. And I took it in June and failed the first one. I passed the second time, but it was really hard. It was really, really hard.
Well, you knew all the questions.
Yeah. Oh, they're different every time though. I wish they were the same, but totally different questions. But yeah, I took the CPH, the certified in public health, and I thought that was hard, but the RS was much, much harder. Um, Is it okay if we go to the next question, or do you have any more on the inspector? Okay. So questions and discussion on federal funding freeze. So with the new administration, federal funds had been frozen. We don't know how that's going to affect the PHE. We did get a message saying that as of right now, everything's okay. And they're going to keep us updated with if there's going to be any changes. So I'm hoping that the state is going to be able to keep covering everything, but there is a slight chance that there could be changes coming down from the federal government. Right now, it looks like the federal government money is coming from ARPA funds, and I think that might have been one of the ones that were frozen. Ileana's actually looking into more information for me today for our chief of staff was asking some more questions about it. So the short answer is I don't know anything different. We just were made aware.
Mm. I've been in contact with Senator Markey and Warren, and their position is that if funds have been obligated, and we all have supposedly obligated our ARPA funds by the end of last year, and contracts are in place, that this money will be paid. Money that's, although it's difficult to say what Mr. Musk thinks about the law. So it's since he seems to be running the government, it's difficult to say. But we're operating as if we're going to get this money. And I think a lot of states are probably going to have to do the same. And if you have contracts that rely half on federal money and half on local money, and the government tells you they're not going to pay, there's going to be lots and lots of lawsuits, and this will all get sorted out at some point, even if it takes 4 years.
Any other discussion on that topic? Okay. The next is vaccine clinic update. So Robin ended up pulling together 2 last-minute vaccine clinics and did an unbelievable job. I think the first one she had 120 shots given. The second one, February 1st, which is like, really late in the season where we usually don't get anybody. She scrounged up 60 shots. There was only one person registered, and she went in, walked up and down the streets in Montague, went to pizza shops, asked everybody to come in, said, there's the $75 gift card, come on in, get your shot. And I could not believe that she actually did it and got 60 people. She ended up hitting a really vulnerable population, which is, I mean, I just cannot speak high enough of her. A lot of the farm workers who are Mexican Americans were afraid to sign up for these clinics because of what was happening in the government. And she ended up recognizing that. She got an interpreter and just said, you don't have to sign up early. I'll just come get you. And that's exactly kind of what was happening is she just ran around town and found people and got them their shots. And it was the most vulnerable. So I just cannot say enough about that.
Megan, could I just ask a question? Was this a flu clinic or was this COVID or both?
Flu and COVID. It was
COVID.
it was sponsored by the DPH. And they had leftover $75 gift cards from last year that they were giving out. So that's where the funds had come from. Speaking of the DPH, we're hearing that next year they're still going to be sponsoring these flu and COVID clinics like they did this year. So they pay for the staff, they pay for the vaccine. And I'm not sure, like, should we rely on that? We do have some money that we could buy our own vaccines. Time to buy is we have to know by March 31st if we're going to be buying our own vaccines, because you have to put in your orders that soon. I feel like they said last year that they weren't going to have these clinics, and then we bought a bunch of vaccines and it just kind of sat here because they ended up hosting the clinics. So I'm thinking we should trust that the DPH is going to have these clinics so that we don't waste money on the flu vaccines. But what are your thoughts? I need to hear others.
I think we should wait for DPH too. I mean, those vaccines have a shelf life, right?
Oh yeah, yeah, they're
Yeah.
only good until June that year.
Yeah.
Unfortunately, Megan, my thoughts are paranoid. I'm thinking we don't know what's going to happen to funding to states, and that I'd rather be prepared this coming year and have purchased some vaccines so we can provide them to our populations and not have to worry. But I'm admittedly paranoid.
Yeah.
How much money are we talking?
They're expensive. So a high dose flu shot is around $70 each,
Yeah.
and a regular dose is around $25 each.
Another question, Megan, how much of that do we get back? Because I know we bill.
Yes. If you give the shots, you get 100% back.
Okay.
If you don't, you lose it.
So you haven't used any of the vaccine that you purchased?
I have used probably about 100 of the ones that we purchased.
Out of
And how many do we have left?
Oh, a lot. I can get 10% of the money back. Probably have $10,000 worth of vaccines that we didn't use because they ended up having the clinics.
And what's the expiration on those?
June. They're really
And
no good now. I mean, nobody wants them at this point.
even for COVID?
Oh, I know COVID vaccines are different. We don't buy COVID
Oh, so
vaccines,
this is just
just flu.
flu. Okay.
Yeah, COVID vaccines around $150 each. There's just no way that we could afford those.
Oh, I thought when Noreen asked you, you said COVID also. Maybe I misheard you.
Oh, maybe I was confused. The DPH clinics are COVID and flu, but
Okay.
we only purchase flu shots in
Okay, thank you.
We have another month, Megan, to make this decision.
do.
Let's
Yeah.
wait.
Well, let's wait and see. A lot is shaken out in the last month. So, I mean, I'm willing to let my paranoia go for a month and
Yeah.
see what else happens
I
to
think
us.
that's very reasonable. And then we can also decide if we do purchase them, do we just do the 65 and over group?
Yeah.
I would recommend if we did that to do that, because those are the ones that we gave out as the 65 and over, because the schools, they all got them at their pediatrician's office or through our clinic. We vaccinated probably 1,000+ people through the state clinics, probably more than that, probably 1,500 in our state clinics.
Yeah, I think that's a good idea to do that.
Can we include it on our agenda for next month?
Absolutely.
Great.
Hey, Ryan's here.
I'm here, yeah, sorry.
No, that's okay.
Could we
At about
perhaps, like,
8:55.
Thank you.
could we perhaps organize through senior centers and nursing to do, earliest possible flu shots if we did purchase or no?
No, we don't want to give them that early. So that was the problem, is that we need to educate our seniors. This is what we need to work on, is educating our seniors not to get them so early. They were getting them in August and September, and it's not good to do that because they have their maximum life for 3 months. So you really want to wait till the end of October to get your flu shot to carry it through. Because right now, our like everybody's waning down.
That's what I was thinking, was like an educational outreach to senior centers saying, here's the best time to get your flu shot and we can provide it to you free. That should be a factor that we're thinking about when we're talking about whether we're going to order our own or not.
Yeah.
Because otherwise, if they're not educated in advance, they're going to do what they're going to do. And then we're going to have a lot of flu shots sitting on the shelf.
Yeah.
So
we do that, but then doctors' offices want the money, and they sent out these notifications in August and September saying now's the time to get your flu shot, because they want the money and the reimbursement because they can charge per shot that they give. So it's not best practice, but we're competing with their doctors' offices.
And also Walgreens and CVS, they have their little placards in, every town that they're in saying, get your shots.
Yes.
Can we get the nurses to go to the Council of Aging and do a presentation?
Absolutely.
Is that something you can arrange?
Yep. We can do it whenever, like maybe
Next year, probably.
July like end of July would be good before they start getting the talk from everybody else.
Mm-hmm.
And Megan, I have another clinical question. I think there've been recommendations that the 65 plus population should be getting a second COVID shot annually. Is that true?
I haven't heard that. I think it's
Okay.
individualized depending on medical issues. So anyone that's immunocompromised,
Okay.
I think they're allowing them to get more than one, but I haven't heard that. I've only heard one.
Okay, thank you.
So just a quick question. I remember years ago, they were thinking it was smarter, I don't know, if smarter is the right word, but targeting young children for the flu
Mhm.
because they tend to be around older people a lot more, grandparents and such. Is that still true? And is that being are the schools doing anything? What is going on with all that?
Yeah, I think it is. Most of our school children got them at their primary care doctors. We have a high vaccination rate for flu, compared to some of the other communities. We did do flu clinics. I believe it was either at Shutesbury or Lever Elementary School. One of the state clinics was there. I can't remember how many they had. I could find out for you. I want to say
We had a
100.
lot.
You did?
Yeah. I think it
Oh,
was
you
like
had the highest number
125.
in this.
Yeah.
Yes,
Yeah.
you had the highest number per capita
Mhm,
in the state, I think, for your clinic.
mhm.
But yes, we do them in Greenfield. We always have a really, really low turnout for flu clinics. And I think it's because we have so many primary care doctors around here that it's easy access to their doctor. They don't have to drive 30 minutes to go to a doctor's appointment to get a flu shot. Sunderland had a really low turnout for we did do a flu clinic at their elementary school. Deerfield was pretty high. I want to say 300.
Megan, if I may, I'm going to ask you the same question I asked for our Board of Health, just in case someone else here might be interested. But I think I read this week where there's been one case of avian flu in Massachusetts, and you said basically low risk here, but maybe you would share why you're feeling that way with
Yeah,
the rest of us.
yeah. I think that I don't think that the human case was in Massachusetts.
Oh, I thought it was. Okay, sorry.
I could be wrong, but the person had extensive medical issues as well.
Mhm.
So avian flu has been around for quite some time, as long as I've been working here. Well, I don't think the first year I dealt with it, but from at least 2022 to 2025, we hear the same things each year. We still have the bird, the killings at the farm and things like that. And so far it hasn't transferred over to humans like in a way that we're concerned about. How do I put this?
Well, there hasn't been human to human transmission, which is like one of the big pieces. If that were to start to happen, that would obviously change the situation quite a bit. And there is some like broad concern that it could evolve in that way at some point. But that hasn't happened to this point. So meaning you have to be exposed by birds, and most of us are not in a situation where we're directly exposed by birds. So you're often looking at farm workers or people that have backyard flocks.
But aren't they concerned that there's been mutations and it's going to, I think maybe cats and other, I mean, I think that's the whole
Yeah,
concern.
that is
And
so
they're
that
recommending,
yeah.
you don't even let your cats out now.
So I think that there is a concern of that, but I think the risk is incredibly low. There was a meeting on 2 Tuesdays ago with Dr. Katie Brown, and she also said the risk is very, very low in Massachusetts. And she's a veterinarian that covers Massachusetts, but also an epidemiologist, and she also said that don't be shocked when we see the results shortly, that it's going to show probably that we have it in cow's milk. Because what they're doing is right now we test milk in Massachusetts and everything has been negative, but they're going to start testing vats of milk, and the milk will come from all different states. But if the vat is in Massachusetts, then they're going to test that and it's going to be positive. So she said, don't get concerned when we see that there's going to be probably the virus in milk in Massachusetts, but it's going to be pasteurized, so people are not going to catch it that way. what else can I tell you about it? I like my personal feelings are that we've heard the same things every single year, and we're always, for every virus that we have, always one mutation off from it being bad. Avian flu is flu A. You know, when you go to the doctor's office and they say you have flu A, it is derived from birds, and the swine flu, flu B, is derived from pigs. So it's been here for a long time. It's just that, you know, we're always concerned about mutations. And right now we're not seeing that, except for that one particular person that caught it.
How is it transmitted?
It's a respiratory.
It
So,
is, okay.
yes, so droplet precautions. The other thing is that in Massachusetts, we don't treat our animals like they do in other states where they're more at risk. So in Massachusetts, we can't have birds on top of each other and multiple birds in cages and things like that. So they're more spread out, less chance of transmission.
Do we have any local, like Diamond Farm, they recently had to redo the way they house their chickens.
Mhm.
Have we any reporting from them about how they're doing?
They have no cases.
Excellent.
Yep. There was a couple birds at UMass that were wild birds that had them. That's the closest that we've seen here.
Megan, that does raise a question for me because we get quite a few geese coming through with the lake. They like to spend a lot of time on the public beaches, and they like to make a lot of droppings.
Yeah.
So, but you're, and so we don't need to worry so much about the droppings.
I'm not quite sure. I would assume that it could, if you're handling the droppings, then it could. I'm assuming it probably could, because flu can also live on surfaces. That's not the primary rate of transmission. It's usually respiratory, but and person to person, it's definitely respiratory. But you know, I would stay away from the droppings and, you know, take your shoes off in the house and things like that. But I don't
I'm
think.
just saying that because people tend to clean up their lawns or their beach areas at the lakes.
Yep.
So they should
Yeah.
probably, if they do that, they should probably wear gloves, use a shovel, things like
Yeah.
that.
Wash your hands.
Yeah.
Yeah.
Okay.
Was the case at UMass with the geese in the pond, Megan?
Mm-hmm. Yes.
That's what I thought, yeah.
And actually one of our coworkers, Nicole, she's a hunter, and they hunt geese, and
Right.
they called the state epidemiologist and asked about the dog and things like that, and they said, don't worry.
I know they did put out a warning to the hunters and sportsmen that
Yeah.
hunt the geese to be very careful if they find geese and stuff like that.
Yeah, they said don't touch any dead birds, but if you're, you know,
Right.
if you're doing the hunting, not to worry about those birds.
Thanks. That's all really helpful.
The ones at UMass, the geese, why were they, what was the story? Were they dead?
Yes, they were dead. They
They
found,
dropped dead.
yeah, there were 2 dead birds that they found, and so they tested them.
Just as a side note, that pond got to be totally polluted. Go by there.
Yeah.
Yes.
That would be more of a concern than the flu to me.
Mhm. So the next topic is, oh, you know what? I skipped nursing updates. I'll go back to that. So nursing updates, let me just do a quick. So Sarah has created an opioid survey, I believe for Leverett and Shutesbury, that she's working on sending out to help decide where the opioid funds are going to go. She's been doing home visits. She's checked in with LifePath. They want to collaborate on getting some services in to your towns. She's working with someone, I believe from UMass, on a healthy food program to teach people how to cook healthy foods. I think she's going to host that in Leverett. She's working on publishing a menstrual equity paper. She's done a bunch of Narcan training privately, and she was going to host a class, but only one person signed up, so she's going to postpone that one. She did a Stop the Bleed training, and she's contemplating going to Texas for a MAFCO is offering to send 3 people to the Public Health Preparedness Convention. And we asked her if she wanted to go. She's very interested. She's just checking with her family and she's going to get back to us today. That would be in the end of April.
That would be great if she could go. John, I think you're still on MAPCO. I would really advocate for that. Yeah.
Yeah, definitely.
Yeah, it was John's idea.
Oh, okay. All right, John. Thank you. Good.
Yeah. And then Anne has been covering Cindy because she's out with a injury. And so she's been going to all of the senior centers, including Whately. They're not technically in our service area, but we said that it was okay because the residents of Sunderland and Deerfield go to that class. So we say that she's servicing our residents in that way. She went to the food pantry the other day and did a blood pressure clinic there. She's distributed hygiene kits. So we purchased a bunch of materials for hygiene kits under the COVID grant. They were requested by Sunderland Elementary, Greenfield Schools, and Montague Schools. So Robin put all those kits together as well as Mary, and we've been delivering them out to the schools. So this is for their 5th grade puberty education lessons. Sadly, John and Noreen, we don't have the funding. PHE has denied us the funding, but we do have that in the other towns. We haven't heard back from Deerfield Elementary School. Anne is going to reach out again today. And hopefully we can get some in there as well. And Anne is also considering going to Texas, but her daughter-in-law is supposed to deliver a baby the week before, so she's not sure if she'll be able to go. She'll make her final decision today. And then Robin has been really hard at work with those flu clinics. She's been working a lot with the Brick House and doing outreach. She's sent COVID tests all over town. All the other nurses have also done the COVID tests as well. And then she made the hygiene kits for Turner's in Greenfield. Any questions on nursing?
Megan, if you, do you have a person at Deerfield that you were going to be contacting about these
Yes, I
hygiene
sent the
kits?
email to the school nurse in Deerfield and also to Casey, the school nurse leader, and I hadn't heard back. And that was about 2 weeks ago.
Okay. If you would like, I can try to follow up. If you forward the email you sent to them, I'll call the superintendent and ask him,
Yeah.
because I've heard that there's been sometimes lack of responsiveness from the school nurses.
Yeah. Yes. So yes, I will. If Anne doesn't have any success today, then I will definitely reach out again. Ryan, you have your hand up.
I just wanted to mention while we're talking about nursing that we do have a TB case that we're kind of figuring out right now. So I'm working with Brittany and then also Myrna to figure out their treatment plan, but we just might require some support on that.
Sure.
Just letting you know.
Yeah.
Cool.
They do have so we have 2 active TB cases in Greenfield right now that we do DOT with, and there's a lot of flexibility, like getting we do FaceTime videos each morning with the
Oh, okay.
person, so we don't actually go to the house to do it. We just do the FaceTime video, which is super helpful.
Yeah, we're still kind of trying to figure out if they actually live here or not, because I guess this was a case that came into our queue previously, and this person then identified that they lived in a different community at that time, so it got transferred out of our queue, and then now maybe they're saying they live here again.
Okay.
And there's been some language issues because originally they were providing a Spanish translation to this person, but they speak Creole, so I'm not sure how that disconnect happened.
Okay.
Yeah, so there's a lot of weirdness with it, so it might not end up being in our community, but it very well could be also.
Okay. Yeah. If you guys need help with that, just let me know.
Great, thanks.
Megan, I just want to make a comment about all the work and that the nurses are doing and what a fantastic job the collaborative has done. You have done in terms of hiring them. They're all wonderful, and thank you so much.
Thank you. Actually, one other question now that I talked about the hygiene kits. MAFCO gave hygiene kits to every town, and they are about this big, and they come with shampoos and things like that. They can be saved for emergency preparedness type things, or they can be distributed now, and you could say, keep them at your house in case you need to evacuate or things like that. Sarah's wondering what Leverett and Shutesbury would like to do with theirs. Do you want her to distribute them out to the community, or do you want to stockpile them?
Is there a shelf life and how many did she get?
We can't find we can't find a date on anything there. I don't know how many your town got. I got 900 for Greenfield, so I'm guessing you probably got around 200 maybe. I'm not quite sure. Somebody would know. Mike Archibald, he was the one that
Right.
sent them out, so we could find out from Mike how many each town got.
Or Sarah will know, she picked them up from him.
She'll know how many cases, yeah. She should know.
And Megan, I'd also like to mention that Ann's become involved with an Alzheimer's group. I believe it's a steering committee for Alzheimer's with the senior
Great.
citizens. And I think she has 3 more meetings to go to see where that's going.
Perfect, perfect.
Megan, I'll bring it up at our next board meeting, but I'm leaning toward giving them out immediately and not, storing them, just having, people can store them in their homes if they want to, in case. There's
Yeah, I feel like that's a good plan.
Yeah.
Is giving them out, but
Okay.
I think that I think the chances of you sheltering at a shelter would be pretty low in your communities because a lot
Right.
of your folks have generators and you guys are pretty hardy out there. So I
Well,
think
I would tend to agree that maybe she should just disperse them.
Mhm.
And will you pass that on to Sarah? You want?
I will tell her just to disperse for Leverett.
As far as I'm concerned, Sarah can make her own determination how it's done,
Okay.
value her immensely. And she seems to do really well and make good decisions.
Okay.
I'm gonna say the same thing, Megan, and I'll just run it by our board at the meeting, and I don't think anybody's gonna say, stop this.
Okay, sounds good.
Am I being remiss? I probably wouldn't even tell our board.
John.
Okay.
Why is it so hard to get members to be on the Board of Health?
I don't know. We only have 2 in Greenfield. And we're a huge city.
We've had the same members like you, Bruce, 2 of whom have been on for 30 years, and I've been on for 13 or 14, so.
And I know the answer in Deerfield. Deerfield, you have to be a selectman too.
Yeah.
I never want to be a selectman. I could be on a board of health, but never a selectman.
That's a requirement in Deerfield?
The Board of
It's-
Selectmen.
Well,
Yeah.
we wear 3 hats, unfortunately. We're the sewer commissioners, we're the Board of Health, and we're also the select board. And sometimes that's a good thing, like in an emergency, you can make executive policy decisions. Sometimes it's not a good thing because we neglect our duties in one place or another. So
But you get
We should
triple the
rethink
pay
it.
though.
and volunteerism is so terrible. I mean, nobody wants to volunteer to do anything. So
No.
I mean, our fire department is just saying, we used to have 40 people and now we've got 8.
Mhm.
So true.
Problem.
It is. But there's a lot of complaining about how things don't get done.
The last thing I had on the agenda is I'm wondering if we could increase Mary's hours. So we haven't been paying the inspector, so we have some extra money in the budget. I was hoping that we could up her to 30 hours only until June 1st. She's currently at 20 hours a week.
There's plenty
Yes.
for her to do.
Yes.
Okay.
So I've been spending all of my time on these surveys. And it would be great if she could help me out with my other duties a little bit more while I do these surveys. And then I was hoping that she could cover me for when I'm out for my surgery and things like that.
And is the money earmarked for salary related?
Yes.
Yep. It has to be for that purpose.
It doesn't
Can't
have
use it.
any money I have can be transferred any place. So any money that we have left over from salaries could be moved to meetings and seminars, or it could be moved to nursing supplies and things like that. Unfortunately, they don't let us buy a lot of things, so we always have money left over in all of
And who doesn't let you buy many things?
the PHE grant. So anytime I want to buy anything, if I want to buy a Band-Aid, I have to send a request to the PHE and they approve or deny. So all of the hygiene things that we do for the COVID grant, I've asked them for, and they're like, nope, can't do it. They let us do it 1 year, the very first year when we were starting, they let us spend it on that because every city was having trouble with funding and things like that. So they let us do it that one time, but they're not going to let us do it anymore. I've even asked for things like I asked for a wheelchair so that we could start a program where we loan out wheelchairs to the community. They said no. COVID test, no. I mean, almost everything they say no to. They've said yes to things like inspectional tools. So we made a bucket for to take out to soil evaluations and things like that with the Munsell soil color chart and waterproof paper and things like that. They say yes to those type of things. They say yes to like GFI outlet switches. They've said yes to some of those things, but they say no to a lot of what we ask for.
Can you explain, you said like the hygiene kits, PHE would not allow for Shutesbury and Leverett. I just don't understand all that, if it's different.
Oh,
I-
it's just because you're not covered under COVID grant. So it's they were purchased with COVID grant money. And Shutesbury and Leverett, unfortunately, you weren't covered under us when that grant started. It's a completely different one.
Okay,
So I could have your nurses go out and teach about hygiene and things like that. But as far as the actual supplies, like we just made these little kits and they have like and show you a little bit of what they have. They have like pads and chapsticks and shampoos and things like that. But the PhD wouldn't let us purchase those. So the only funding was from the COVID grant. Which I'm also trying to sort out all the money from the COVID grant because they told us that we had $22,000 left from last year. But when I looked in I just got access to the budget and it looked like we were minus 70,000. They found 50,000 of that just through accounting. They're like, oh, well, there's a check and we put it into some other account. And so I got that back. So we are working on getting all of our money where it needs to be. I know that's not PHE, but for everybody else that is on this meeting, because I want to get it all spent down before the grant runs out next year.
So do we have to make a motion to increase the hours?
Yes, you would need to do that.
I make a motion, we increase Mary's hours to 30 hours a week from 20.
Until
Second.
June.
until June what?
Okay. Any discussion?
It would be June 30th.
Did anybody second it?
June 1st.
I
Tim, I
did.
think, seconded it.
Okay.
All in favor, Tim,
Tim Hilchi, aye.
John,
Aye.
Noreen,
Yes,
Ryan,
Yes.
and Bruce?
Yes.
Thank you. Anything else that we need to talk about before we adjourn?
Yeah, I just wanted to bring some unanticipated business.
Absolutely.
I think at this time I'm going to step down from the chairperson position. I have a lot of other similar roles, and now that Megan, you've taken quite some time to kind of come up to speed with everything, and you're the grant coordinator now officially. I would suggest politely that we nominate Megan as the chairperson because I think it makes a little bit more sense, and I've also been a bit negligent in my ability to be here on time a couple times, so Megan's been doing it anyway.
Second.
wait a minute, how do you feel about that,
Yeah.
Megan?
Well,
Sure,
no,
it's totally fine.
that's the
You
discussion.
don't have a
point.
choice.
Totally fine.
Thank you, Megan. I appreciate that.
No problem.
Thank you for all you've done, Ryan.
You're very welcome.
And Noreen, you made the motion. Was there a second?
Yes.
Second,
All in favor, Noreen,
Yes.
Ryan,
Yes.
Bruce,
yes,
Tim,
Yes.
John.
Yes.
Did I
And
get every-
Megan, I'm not sure I made that motion. I think I just commented on it, so I'm not sure who made the motion.
It's all right.
Ryan made the motion. I seconded.
Okay, thank you.
And Megan, if you need any help with any of this, like I'm obviously still available to support you on it. I just think it makes more sense to pass it over to you.
I think I'm getting a little bit of the hang of Robert's rules now.
Cool. Okay, great.
All right. If nothing else, does anyone want to make a motion to adjourn?
But I have something I want to talk about.
Absolutely.
The minutes. I don't know how to, I guess what I was gonna say is when I reviewed them, I feel like they're very loosely done. I think they don't put a lot of people's last name. And I don't know if we're doing these, theoretically, the idea of minutes are that anybody could come in and read them.
Okay.
And they're not done that way. And I don't know how other people feel about it, but I don't always know who everybody is, quite frankly. And to me, it would be better that a little more time be put into it to be a little more specific about things. That's a feedback. And the other thing is, I think it would be beneficial that before they're sent out, because I know Mary did it last time, that she sort of give it a day or so and then reread it and then send it out. Because, you know, you don't always see things the first time.
So since I was also somebody who sent an edited version, I didn't address the issue of everybody who attends the meeting is identified at the top by their full name. I actually corrected some instances where it was Meg instead of Megan. In the body of the text, I didn't bother to correct to say Megan Tudrin or Ms. Tudrin or whatever. So my feeling about minutes is that since meetings are recorded, they should be a summary. They shouldn't be so detailed that you have recorded the fact that I said 5 minutes of commentary about the minutes. You know, that's my personal opinion. Maybe we should, in Deerfield, we're using AI to summarize videos and so forth to help us write our minutes, because in COVID, we got backlogged 3 years. We're trying to catch up. But I've had the experience of minutes being so detailed, and oftentimes by trying to be detailed, you mislead people or you get something incorrect, and then minutes just sort of get approved. So I would prefer it to be summary of motions, what was decided, if money was expended, rather than, you know, a verbatim account of what happened in the meeting. But that's my opinion.
Yeah, and
Mary-
I wasn't suggesting it be verbatim at all by any means. I was just suggesting that people be identified by their last name.
Seems reasonable.
Some of the stuff just didn't make sense when you read it as a sentence. I don't know if you noticed that.
Exactly. I rewrote a bunch of sentences, and I could have misinterpreted because
I was put in as Shutesbury. There are a couple, I would say, glaring errors.
yeah, I
And
agree.
again, I agree. It doesn't need to be verbatim. It just needs to give the general tenor of what it is. And probably motion should be verbatim. But
Mhm. Something Deerfield's done recently too is actually, if we're having a meeting, the select board has motions pre-written so that if we're going to vote on a thing, we at least say it correctly. I know we're not going to do that here, but I agree, John, that misidentifying things. One thing I'd like is I can't put Deerfield in my identity here. Usually in a Zoom meeting, I can go in and edit what it says about me, but I can't here, so the video wouldn't help anybody to know that I'm from Deerfield.
Really, you can't do that?
And
Just the way
when I
it's
press the
done?
little 3 buttons, it doesn't give me that option. It gives me choose avatar, video filter, adjust background effects, pin, hide self, but no rename.
Huh.
In other Zooms, I always have the ability to rename. And I think it's probably a setting that somebody made at some point.
Yeah, that's
And
just a
also I
meeting
can't
setting.
clap or I can't react to anything because the choices at the bottom are limited. Not that we need to, have little emojis saying clap, but it's just a different palette of choices that I have in this Zoom.
I was able to rename you. So maybe we should do that each time. Like maybe as we
Yeah, or maybe
start.
maybe there's a setting in this that allows individuals to do their own thing. But thank you, I appreciate that.
While we're on this, I have one question, or I need a reminder. When you posted the meeting to us, you reminded us to post the meeting to our town. Can you just go through how we do that?
So I think that there's someone in the town hall that is supposed to stamp it with something and then just post it 3 days ahead of time. I'm not
Okay.
48 hours ahead of time, I think. I am not sure on that. We did in one of our meetings make a motion to change it so that the meetings only have to be posted in Deerfield. So
Oh, okay.
we have sent in that application to the state. I mean, sorry, in Greenfield. So we have sent that application to the state. And as soon as they approve it, then we can send out a letter to your town saying from now on, all meetings will just be posted on the Greenfield city webpage. And then you won't have to do this every month.
Okay. That would be great if that happens. But maybe just in the meantime, we should go over how we should be doing this. So, I mean, you just gave us sort of.
Tim or Ryan, do you know, is it 48 hours in advance that it has to be stamped and posted?
I do know that, but
Oh.
I'm just not sure. It's 48 hours. I know when we post our meetings for Board of Health, it has to be 48 hours.
Mhm.
But I think the chair of each board is doing it, I believe. Posting the meetings.
Oh.
In
Yeah,
our
yeah,
I
town,
think
we have somebody who posts.
Yeah.
Yeah.
And we send it to postings at Deerfield.intown.deerfield, blah, blah, blah. And then the clerk posts it and
Right.
stamps it.
Right.
I thought the way we were gonna do it earlier was that it was gonna be sent out to the town clerk or something. That we
Yeah.
wouldn't go through us. When I say us, the steering committee people.
Yeah, I kind
Or
of
the
thought
Board
that
of
too,
Health.
John. That's why it surprised me when it was on this one for us to post it. So,
Yeah, I just forwarded it to our clerk and I said, if you can't do it, send it to our town clerk.
I would also suggest that we have Mary send them to the clerks. It seems well fitted within her role, and we're also authorizing
Yeah.
additional hours.
she normally does that, except she was on vacation this week, so I did it. So I might have done something wrong this week instead of what she normally does. So Noreen, do you normally get it sent to the clerk? Do you think?
And when I say clerk, I thought that it was sent to the town clerk.
Yeah.
yes, town clerk. That would be I believe so. And I just saw that notice and I thought, oh.
Oh, so that was probably me. I probably
Okay.
did something wrong because Mary normally does that.
All right. Okay. So, all right, good. Well, if Mary's doing it, that takes care of everything. But maybe just double check with her,
Okay.
Megan, until we get this approval from the state for it to be posted through Greenfield. That'd be awesome. I don't want to cause more work. I just want
No,
to know that
no.
we're doing.
I
what
want
we're
to do
supposed
everything
do.
right. So please, if I'm doing something wrong, tell me. I need to know.
It was just a change that I noticed. That's why I'm reacting.
So, can I have a couple things?
Absolutely.
Just out of curiosity. Tim, you said you record your minutes, your meetings rather, and then use AI to develop your minutes?
That is what's currently being practiced. It's sort of an experimental thing, but what the AI does is it takes the Frontier Community Action TV recording of the meeting, and it runs through and analyzes what's been said, creates a framework, and then we have an actual person go through and start from that point. Whether it seems to be making it easier for the person who's trying to recreate all these minutes from past meetings. I don't know the specifics of it because I don't do it. But if you're interested in having somebody talk about that, it may or may not be something you do. I don't know if your meetings are recorded by FCAT or anybody.
We don't record it, but I'll bring it up to our meeting and see if people have.
Yeah.
I was just curious.
Yeah, I
These
mean,
meetings are a pain, the minutes rather.
yeah. Well, if we can be helpful, I can
Okay.
refer you to the
Thank
right
you.
people.
Yep. And I have another
Yeah.
different topic. PFAS, is anybody dealing with PFAS in their town?
Yes, we are.
We are too.
And who is, I saw Noreen, who was the other person? Was that?
Bruce.
And you guys have started writing regs?
No, we don't have regs, John. What happened is our own old landfill on Reservation Road. They take water samples there, DEP does, and it came up with PFAS in one of the residents near their water supply. So we're dealing with that.
Similar
The
case
reason-
with us, John.
Excuse me?
Similar situation with us. We had pre-existing PFAS, or when the state came in and did testing of various wells a couple of years ago, it showed up.
Right. Well, no, the reason I'm asking is because we have the same thing. There were a number of residents that have contaminated wells that are, but we're gonna write, we are in the process of trying to deal with regulations specific to PFAS and a few other things, water regs. And I was just curious if other people have been doing that. And
We
so,
haven't looked at,
okay.
we have not looked at regulations, John. We're just
Okay.
dealing with this one situation. But in our case, the latest test that they came up with, it was negative with PFAS. So evidently the PFAS moves with the water.
Right, but do you have wells near there? You have, I know you have town water a lot of places.
Yeah, but town water is only at the center of town, kind of. And out by Reservation Road where Cranberry Pond is.
Oh, over there. Oh, okay.
That's where we have the issue, John.
Okay.
And that's where our old landfill was, and there's houses near there and the water's contaminated.
And those are right, and those would be private wells.
That's correct. They're all private wells out there. Yes, that's
Right,
correct.
so it wouldn't, see, we're concerned with certain areas where there's known PFAS. That if there's gonna be new construction or transfer of property, that we want to make sure they are test for PFAS.
And there's a good chance that a private well regulation is still in the works for the state.
Say it again?
The state, there's still a good chance that a bill might progress with respect to private well regulations.
Oh, really?
Yeah, I can send you some information about it, but
Sure.
there's
I was actually gonna reach out to Mike Hugo, because I assume he might have some information. But okay,
I would assume, John, that in a property transfer, the banks would require a water test.
yeah, but why would the bank, that's, I don't know if that's true, that may be. But when you say a water test, what are they gonna test for?
Well, they
Like
would
what?
test, they would check for what chemicals are in it. And if there are PFAS there, they might not grant the mortgage.
I don't think they
Right,
test
but-
for PFAS. They only test for E. coli and nitrates.
Well, it depends what you ask the
It
test for.
depends
and
what you
the
ask
town
for, yeah.
requires. PFAS is an additional cost, and what we are planning on doing is, because the state or DEP had done a lot of testing in different areas, we have some idea where PFAS is. We don't know the source, but we can have a geographical area and have those areas be tested.
I think that would be a good idea.
So Ryan, did you just send me a link to that? Oh, yeah, you did.
Yeah, it's a news story about when the bill was first proposed, but I do think that there's some political momentum that's occurred since then.
Okay, great.
On another note, Sarah just sent me a message. She is interested in going to the conference, so I will let MAFCO know. They just have to send the people's names to the state to approve the funding, but it sounds like it'll go through.
Great.
Anything else? Okay. Do we have a motion to adjourn?
So move.
Second,
All in favor, John?
Yes.
Tim?
yes.
Bruce? Ryan?
Yep.
Who am I missing?
Noreen, yes.
Noreen. And is that a yes, Noreen?
Yes, it is.
All right, thank you. Sorry about that. All right, well, we will see you all next month.